Hello, everybody. Welcome to the Colorado HMIS Statewide Coordinated Entry Training. Today, we're going to be going through different content around what a continuum of care is, what HMIS is, coordinated entry across the state and across the continuums of care, and also our Built for Zero initiative. Now we're going to go into introductions. And I'll start. My name is Sean Hayes. I work for the Metro Denver Homeless Initiative for the Metro Denver COC. So turn it over to Mo.
Hello, everyone. I'm Mo. I am with the Northern Colorado Continuum of Care. Thanks for being here today.
Hi, friends. I'm Matt Richard. I'm with the Balance of State Continuum of Care at the Colorado Department of Local Affairs.
Hi, everyone. I'm Sophie Janorowitz. I am also with the Northern Colorado Continuum of Care.
I'm Heather Brinker, and I'm with the Pikes Peak Continuum of Care.
My name is Megan Morales, and I'm with the Metro Denver Continuum of Care.
Hello, I'm Angela Roberts. I am with the Pikes Peak Continuum of Care, and I also lead the efforts of the Built for Zero work in the Pikes Peak region.
Great, and we'll start things off with Mo.
Awesome, thank you. So first off, what is a continuum of care? We also call it a COC. COC is a federally determined region responsible for organizing and coordinating a community's response to homelessness. This includes collecting data, supporting resources based on priorities that reflect the needs of the region. So some things that COCs are responsible for are distribution of federal funds, uphold evidence-based practices, and data collection. There are 4 COCs in Colorado at this time. So we have Metro Denver, Northern Colorado, Pikes Peak, and the Balance of State. And what makes up a homeless crisis response system? Anyone can participate in a COC. So any agency or organization that directly or indirectly services people experiencing homelessness, community partners invested in addressing homelessness as well. So some of these providers are either direct service providers or indirect service providers. Direct service providers being shelters, so that could be day shelters, overnight shelters, emergency shelters, street outreach teams, transitional housing, permanent supportive housing, homeless prevention, and some indirect service providers are city and council governments, healthcare systems, so that could include mental and behavioral health systems, the criminal justice system, emergency and crisis services, and the co-response teams. And then I believe next up is Matt. So I'll
Awesome.
let you go, Matt.
Thanks, Mo. So in terms of HMIS, or a Homeless Management Information System, that's a system that's designated by the local continuums of care, which we use to record and analyze client service and housing data for individuals and families who are either experiencing homelessness or at risk of experiencing homelessness. This is required by HUD, or the U.S. Department of Housing and Urban Development, through the Office of Special Needs Assistance Programs, or SNAPS. And this is the comprehensive data response to the congressional mandate to report annually on national homelessness. And in terms of who uses HMIS, it's going to be those providers that receive that federal funding for homeless services through HUD, through the Department of Health and Human Services, or the Department of Veteran Affairs, all of which have those requirements to use the HMIS that's been selected by their continuum of care. But also providers who might be funded by state or local governments here in Colorado may have requirements to use HMIS as well. And other providers just choose to use our system due to the care coordination opportunities that it provides. And as of several years ago, COCs that receive federal funding for coordinated entry are also now required to use HMIS to capture those coordinated entry activities. Okay, it was a map of the 4 COCs in Colorado, just kind of showing you that in Metro Denver, that's the 7-county region we went over on the previous slide. And we have the Northern Colorado COC, which is Larimer and Weld, the El Paso COC, which is really the Pikes Peak Continuum of Care, and the balance of state, which is the 54 remaining counties. So, and we do have a statewide HMIS in Colorado, which is really helpful from a care coordination standpoint. Folks who sign our ROIs and might be moving between COCs, providers can access their records and, not have to ask those folks onto the slide now.
Awesome. Thanks, Matt. So now we're kind of going to move into what is coordinated entry and the benefits of coordinated entry systems. Coordinated entry is a HUD-mandated system for allocating housing resources to eligible households experiencing homelessness in the area. Overall, the goal of coordinated entry is to ensure that people experiencing homelessness have access to housing resources in an equitable fashion, and then obviously with the end goal of resolving their housing crisis. Funding sources are a determining factor for whether a program will take referrals through coordinated entry or not. So for instance, COC and ESG funded programs will require 100% of their referrals to come through coordinated entry. But other funding sources like state or local funders may also require all or a percentage of referrals to come from coordinated entry. That all being said, programs can choose if they want to take referrals through coordinated entry, even if their funding source does not require that. And then an important note is that each COC has their own coordinated entry system to serve the people experiencing homelessness in their community. Perfect. The benefits of coordinated entry. So coordinated entry systems offer a lot of benefits for all members of the community. For instance, the data collected through coordinated entry can help determine the scope of need for a community and hopefully allow for a greater amount of money or resources to be allocated to this cause. Coordinated entry also allows for a more equitable process for the distribution of housing resources, utilizing the basis of needs of households rather than their abilities. Along with this, coordinated entry also allows for a streamlined process for individuals experiencing homelessness to potentially obtain housing. Coordinated entry requires one enrollment per COC. So a household can be engaging in services in many different agencies, but one coordinated entry enrollment will allow them access to the system and potential resources. Coordinated entry also allows for interagency care coordination. The community built through case conferencing meetings allows for agencies to work together to support those experiencing homelessness to the best of their abilities. The use of a centralized database, kind of as Matt mentioned before, not just across each COC, but across the entire state, also aids in the care coordination of households, especially those kind of moving between COCs. Awesome. So the basic role of coordinated entry. The process of coordinated entry from start to finish kind of looks like this. The first step is going to be access, and this is the ability for people experiencing homelessness in our community to access agencies that are coordinated entry partners. From there, the next step would be assessment. In this step, households experiencing homelessness will complete an assessment with a trained partner agency in order to be enrolled in the coordinated entry system. Another important note is that there's not a standardized assessment that's used across Colorado. Each COC kind of has their ability to choose their own assessment tool. From there, we move on to the prioritization step. So individuals or families enrolled in coordinated entry are prioritized for resources based on COC specific and documented criteria. So in Northern Colorado, we are currently working on Perfect. In Northern Colorado, we're currently working on changing our prioritization criteria and our assessment tool. So that's kind of another thing that's determined COC by COC. And then the last step in this process would be the referral. And this is the stage in which an eligible household is referred to an available housing resource in the community. And these referrals are made in case conferencing meetings. Awesome. So what populations are served through coordinated entry? Coordinated entry serves many different populations of people experiencing homelessness. The primary populations that we see would be individuals, so AKA like single adults. This would include adult couples without minor children. And then we move into households with minor children. So this would be families. And then our last one would be youth, or AKA young adults. This includes households with a head of household between the ages of 18 and 24. From there, we also have some subpopulations that we identify in coordinated entry systems. These subpopulations include veterans and then survivors of domestic violence. Awesome. In order for a household to be enrolled in a coordinated entry program, there are a few things that they will need to complete. First is releases of information. There is an HMIS release of information, and then there also can be releases of information specific to the coordinated entry system. In Northern Colorado, coordinated entry participants also sign a CAPS ROI, CAPS being the name of our coordinated entry system. Households then answer the questions present in the client profile of HMIS, and this includes topics like their name, their date of birth, gender identity, things like that. From there, they move on to complete the coordinated entry intake or enrollment questions. This includes more specific questions like those surrounding someone's history of homelessness. They're also going to need to complete a coordinated entry assessment in current living situation, or CLS. A CLS is pretty much exactly what it sounds like. It's an updated location to know what type of situation a person is living in that time. And then the last thing you're going to see in a coordinated entry enrollment is an exit, obviously at the appropriate time. There's many reasons that a person may be exited from coordinated entry. Obviously, the goal is for them to be exited to housing. So for instance, like a rental by the client, but other reasons could include like the loss of contact with that person, or that person's move to a new COC or possibly a new state. That is all I have for right now. I'm going to pass it off to Mo to talk about who participates in coordinated entry.
Awesome. Thanks, Sophie. So who participates in coordinated entry? So the first participant in coordinated entry would be people experiencing homelessness. So these individuals connect with the partnering agency and complete the coordinated entry enrollment process. And then they keep in contact with that partner agency that they are working with. The next participant in coordinated entry is assessors. So this is trained staff within agencies that serve people experiencing homelessness. So these could be folks in shelter or outreach, population-specific providers, so veteran providers, youth providers, family providers, and individual providers or single adult providers, mental and behavioral health providers, case management teams, and resource navigators, etc. So assessors can complete an assessment and support in navigating resources with participants and support care coordination with other providers. Another participant is housing providers and agencies. So they communicate eligibility criteria and expectations of their programs, notify coordinated entry systems of openings, and they receive referrals. When they receive referrals, they contact them, determine their eligibility and interest in the program, and either enroll the household in the housing program, or they can deny that referral as appropriate, depending on the program. And coordinated entry staff are also participants in coordinated entry. So these staff are responsible for supporting or managing day-to-day functions of coordinated entry, which may include any combination of the following. So maintaining a prioritization list, communicating referrals, facilitating case conference meetings, monitoring case coordinated entry activity, and preparing coordinated entry monitoring and evaluation reports. And I'm gonna hand it back to Sophie.
Thanks, Mo. We're going to move on to kind of the eligibility for coordinated entry. And it's important to note that the specific eligibility for each coordinated entry system is going to vary a little bit by each continuum of care. So starting off with the HUD definition of literally homeless. Being literally homeless is also known as experiencing Category 1 homelessness. And in order to be considered Category 1 or literally homeless, a household must meet one of the following criteria. First, have a primary nighttime residence that is a public or private place not meant for human habitation. So for instance, this could be sleeping outside or sleeping in your car, something along those lines. Second, living in a public or privately owned shelter. So in this case, that could be an emergency shelter, transitional housing, or a hotel or motel paid for by a charitable organization or government funded program. The third thing that would kind of qualify someone as literally homeless would be that they're exiting an institution like jail, a hospital, or a rehabilitation program where they resided for less than 90 days. The caveat with this kind of third option is that the person had to have been experiencing literal homeless prior to entering the institutional setting. And institutional stays of 90 days or more are considered a break in homelessness. So then HUD then defines the imminent risk of homelessness as a household that will, 1, lose their residence within the next 14 days, 2, have no subsequent residents identified, and 3, lacks the resource and support networks needed to obtain other permanent housing. This includes households that were owning or renting a residence, as well as those living in situations that did not necessarily require them to pay rent. So things like staying with family or friends without kind of that monetary payment every month. Moving on, we also see Category 4 homelessness, and Category 4 homelessness is when someone is fleeing or attempting to flee their abusive partner. In order to be considered Category 4, you must be actively fleeing or attempting to flee a domestic violence situation, have no other residence, and then lack the resources or support networks to obtain other permanent housing. It's important to note that you don't necessarily need to be literally homeless in order to be experiencing Category 4 homelessness. Another important note is that domestic violence specific providers don't actually enter their data into HMIS like other coordinated entry partners do. In order to protect the safety and confidentiality of those fleeing or attempting to flee domestic violence, these providers include their data within the coordinated entry process in a different manner. That manner kind of looks different in each COC, but none of that information is being put into the HMIS database. Also, households experiencing domestic violence do not need to be served by a domestic violence partner in order to be enrolled in the coordinated entry system. So they can be served by the other partners of coordinated entry. Moving on to the HUD definition of chronically homeless. So the HUD definition of chronically homeless can quite honestly be a little tricky to understand at first. It took me a little bit to fully grasp what this meant. And that's because there's a couple of aspects that work together to determine whether someone is considered chronically homeless or not. There are many housing resources assigned through coordinated entry that require referrals to meet this HUD definition of chronicity. So in order to be considered chronically homeless per HUD, one must meet the following requirements. 1, you must be a homeless individual with a disability. 2, you must live in a place not meant for habitation, a safe haven, or an emergency shelter. And 3, you must have been homeless for at least 12 months or on at least 4 separate occasions in the last 3 years that combine to be at least 12 months. So that's where it gets a little bit tricky. You can also be considered chronically homeless if you have been staying at an institutional setting for less than 90 days, but had met the definition of chronically homeless prior to entering that situation. Because that less than 90-day stay is not considered a break in homelessness, you can maintain that chronic status. And then lastly, in terms of families, families are considered chronically homeless when their head of household meets the definition included in this slide. The other members of the family do not necessarily need to meet the HUD definition of chronically homeless in order for the family as a whole to be considered chronic, because that head of household is meeting that definition. And with that, I'm going to pass it off to Heather to talk about housing programs and case conferencing.
I should have had a good joke to wake everybody up by this time. Good job, everybody. Anyway, so there's different housing programs that come through coordinated entry, and most of them all fall under these categories. One is vouchers. This is not the vouchers like Section 8 or housing choice. That is something different, but sometimes the vouchers do come through coordinated entry or case conference, such as we had emergency housing vouchers for a short time, and we had to identify people through case conference for those specific vouchers. Sometimes the vouchers can be assigned to different households or like apartments. So like we have an apartment complex where the vouchers are assigned to each apartment. So if the household moves out, that voucher does not follow them. It stays specifically with the unit. Vouchers are basically a form of rent subsidy that helps low income individuals, families, seniors, people with disabilities afford a decent, safe, and sanitary housing. Most of the time it is administered by the Public Housing Authority. They usually issue the voucher and approve the application. Again, it can be specific to the building, or it can be a tenant-based, where that means then if it's tenant-based that it does follow the tenant if they move. And they keep that voucher as long, if it is a tenant-based voucher, as long as they meet the criteria. So it can be long-term, or it may or may not have case management with it. And there are other criteria that must be met depending on the voucher requirements. Another popular thing that comes through coordinated entry case conference is, again, rapid rehousing. You've heard of it as RRH. This is also for veterans, it would be SSVF. And it's basically a short-term rental assistance. It's not a voucher, it's just short-term rent assistance, usually to cover like deposit, first month's rent. And then depending on each program, it can go anywhere for a couple months to 24 months, depending again on the program. Usually the criteria is the household income must be under 30% AMI and the rental must be under fair market rent to qualify. The other very large program is permanent supportive housing, also called PSH. That is permanent housing is in which housing assistance and supportive services are provided to assist the households, at least one of the members with a disability, in achieving housing stability. A lot of people get confused and think that automatically they get all these wraparound services, but it is up to the client to be able to access those services. It is a choice, but they will be, of course, more successful if they reach out and follow through the case management or the supportive services. Usually the vouchers for each apartment in the permanent supportive housing is what provides the rental assistance. The other very big thing is transitional housing, which is temporary housing with supportive services to individuals or families or youth who are experiencing homelessness. And the goal is interim stability and support to successfully move to and maintain permanent housing. Transitional housing projects can cover housing costs and accompanying supportive services. Again, it depends on each program of how long those services last, but it can be short-term to 24 months. And we'll go ahead to the next slide. And then what is case conferencing? So under coordinated entry, we have case conferencing. And again, I want to stress that it's different under each CE. We do it all differently, so it is not just a standard way to run them. So case conferencing is basically a community-wide effort to gather accurate information and paint a comprehensive pictures of individuals or families seeking housing. It's basically designed to target the most appropriate housing intervention available in the community. So usually it's regular scheduled meetings, bringing partners together, the agencies, to focus on those who are experiencing homelessness in the coordinated entry system who are enrolled in HMIS. It involves usually staff from different agencies or projects, the CE staff. Basically, you discuss the barriers to housing that they may have, who may be the best fit for permanent supportive housing, who may be the best fit for this, what kind of documents do they have. It's basically to get a whole picture of that individual or household so that the most appropriate housing resources can be provided to them. And then I will pass it off to Megan.
Hi, thank you, Heather. All right, so I'm going to talk a bit about moving between continuums of care in our coordinated entry systems. So like Matt mentioned, we do have a statewide homeless management information system, HMIS. So if the participant grants permissions for their data to be shared across the system, you can see that information when you log into the person's profile, or when you log into HMIS and search the person's profile. So yeah, it is visible across the state. Right now, the process to move between COCs in Colorado is highly individualized. It depends on the situation. And one of our goals is to make this more uniform and more streamlined. Yeah, so I'll go ahead and let's go ahead and go to the next slide. So if you see someone is enrolled in another COC, so you'll see that when you're on the person's client profile, you can see that which programs they're enrolled in on the right or under the programs tab. So if you do see that, we need to make the following steps. So first would be having a conversation with the household to understand where they would like to live long-term. If they're prioritized and referred to housing, where would they like to live in the state? And where would they like to receive services? If it's in another continuum of care, then you would submit a ticket to the HMIS Zen desk to have the case closed. So we would want to close out their current case in the COC. So say they are currently in the Pikes Peak COC and they want to live in northern Colorado, they would need to have the assessor or the case manager working with them submit a ticket to the Zen desk and have them closed in the COC they left. So they would be closed in Pikes Peak so that they can receive full services in the geographic location that they have chosen. In my example, northern Colorado. And then they should not be enrolled in more than one continuum of care when receiving services in another. So really trying to make sure that wherever they're living is where they living or want to be living is where they're getting those services and connections. Because each of our coordinated entry systems operate slightly different, they all have their own unique assessment. If they transfer to another COC, they do need to be reassessed with that COC's community assessment for coordinated entry and go through that COC's process. So yeah, so the way the functionality in HMIS works with referring to the community queue and being assessed, it all has to work within the data collected for that COC. Okay. So as we've talked about, these are the 4 COCs. They each have a unique project name for their coordinated entry system. I'm not going to read these off, but you can see here that we've listed the project names that when you're on a client's profile, you can see these either on the side or in the programs tab to know that they are enrolled in a different COC or the same COC that you're currently in. So that's how you can check. And then there are separate HMIS help desk emails for each COC just to make sure we're filtering information, even though statewide, we want to be able to filter information between the COCs that people are working within or participating in those services. So these are listed. I'm once again not going to read them out, but there you can see how people can submit a help desk ticket to get that to get everything sorted when someone switches to a different COC. And then there's, the Zendesk website. You can also submit a ticket as well. So you can see that link on the bottom. Okay, yeah, next slide.
And I can jump in here and talk about Built for Zero a little bit. So while all these different communities are working through the coordinated entry system and tracking data in HMIS, there's also this framework and this methodology that's referred to as Built for Zero, which many folks have probably heard the term, may not be super clear on what it is. But it's a framework that's really there to help support a community who's attempting to reach what's called functional zero for the population that they serve. So the idea is to measurably make a commitment in a community to measurably commit to measurably ending homelessness. And this is happening all over the country. And all COCs in Colorado are committed to this work. The main goal, just like with the continuum of care, is to make homelessness rare and brief when it occurs. Let's go to the next slide, please. So you'll also, when you are researching or learning more about Built for Zero efforts, functional zero is a term that's going to come up regularly. The idea is that homelessness is not going to end permanently. However, is the homeless response system in a community set up so that when someone is experiencing homelessness, it is rare and brief and non-recurring? So really focusing in on the data of where folks are coming into the system, what kind of resources are they being connected to, and how quickly are they being connected to them so that they have a permanent solution that ends their housing crisis. A great example to think about is if we imagine that our homeless system is operated like a well-functioning hospital, and the hospital will not necessarily prevent people from coming in or getting injured or sick, but it will ensure that people are triaged properly and promptly so that they get the services they need, they get their issue addressed, and further harm is prevented. We do have a website on the previous slide, so if you're interested in learning more about this Built for Zero methodology, or if you want to learn about how other communities are using this, and learning about the success of using this methodology, take a look there. And I think that is it. Is there another slide for Built for Zero? Okay, that's it. Thanks.
Yeah, we just have our contact information for each COC on this slide. So if you would like to connect with your corresponding continuum of care, here's that information. And then I believe the next slide is just questions. So are there any questions?
We've answered quite a few in the Q&A section, so if you want to take a look at those, that might be helpful as well, and you're totally welcome to go to put them in the chat as well.
Yeah, I think there was a good question about streamlining the ability for clients who are transferring between COCs without needing to be reassessed. And I addressed that with an answer, but I think it's good to say out loud with everybody here too. The group that's presenting today, we're all meeting regularly to discuss and streamline coordinated entry as much as we can, right? Certain things are designated by HUD to be developed by your local region, right? To create that assessment in ways that help you accurately assess folks for the resources that they're eligible for and prioritize them for that. And that might look different in the metropolitan area versus like rural Colorado areas, right? So we want to make sure we can align as much as possible, but it just might not be apples to apples across all of the COCs, unfortunately.
Yeah, that's a good point, Matt. That I was thinking too, that, you know, we would love to make it as streamlined as possible, but we do things very differently with identifying and different programs that we each have. So you just need to keep that in mind that, you know, maybe a person is up for permanent supportive housing in Denver and now decides they want to go to Colorado Springs. We don't have a lot of permanent supportive housing down in Colorado Springs. So even though they might be next in line up in Denver, it could be a very long way down here. So just being aware that each section has very different agencies.
Yeah, and client choice is a really important part of all of this as well, Heather. So thanks for flagging that. I've seen a couple extra questions come into the chat. I can go ahead and address those verbally too. The slides will be shared, as will the recording. In terms of the initiatives being done to get the word out about coordinated entry in rural areas, we have reformed our Balance of State Coordinated Entry Committee, and we're working hard to kind of standardize policies and procedures and workflows and reporting. And as a part of that, we've helped kind of collect information about the access points in each of our regions and are trying to make that information available in more public-facing ways for folks who are, experiencing a housing crisis. Having clear documentation for where they can go to get help and to get support is super important, and our team is hard at work at trying to button those details up. So hopefully that helps on that question, Becky. We have another question about defining actively fleeing DV. Does one of my other panelists want to tackle that one?
So, yeah, HUD doesn't actually say what is actually actively fleeing. I mean, I don't know, has anybody ever heard that with HUD of what actively is, but basically fleeing or attempting fleeing at the moment. And then again, the resident lacks the resources. You know, if it happened a year ago, then no, they're not active. I would say, unfortunately, it's kind of common sense of actively. I don't know what everybody else thinks, but I would say within the last 90 days. That's
And-
the official.
Yeah, and I think it's just, you know, if a person is, you know, either they don't have to be actively experiencing homelessness, but they're trying to get away from a dangerous situation. I think it's just kind of working with those folks and having those conversations. I think those are details that you can, I think, suss out without too much trouble. But Megan, Sean, I don't know if there's any other context you'd share there either.
Yeah, I put it in the chat. There's not a like specific, you have to have been fleeing within the last X amount of time. It is really defined by the household self-report. So if they feel like they're fleeing domestic violence, that's how it's determined when they when you are collecting doing intakes and such like things like that. But they do need to meet that second part of it, which is that they have no other residents and they have no support systems or resources to obtain other permanent housing. So there's no kind of like, at least for the coordinated entry enrollments, there's no need to like get a verification that they're fleeing domestic violence.
Looks like there's another question. Are there lists of affordable housing units that accept vouchers? How often are these maintained? And I think that's going to be individualized per COC.
It's very time consuming to keep those lists updated. And apartments cannot deny you because of a voucher. So all apartments should take vouchers. You know, we all know that they find ways around it, but by law, they cannot deny somebody because of a voucher. So I'm not sure if that's kind of what you were more meaning. And you can come off mute if you want and talk about it a little bit more.
And I can echo just the challenge of keeping a list maintained and updated. Yes, a property manager or landlord company cannot discriminate against source of income. And then there's definitely properties that have income restrictions that you can find online. I know in our area, the Colorado Springs Housing Authority has various properties that are listed on their website. But something that we do in Colorado Springs is send out a daily availability list that shows affordable rentals that would meet different payment standards that are required for voucher holders. Again, each community is going to handle that a little differently though.
Another question in the chat, is there a good success story that illustrates how coordinated entry works well?
I mean, I think all of us could think of certain times, but I mean, it just helps really streamline that as soon as there is availability that we get people in as soon as we can that are housed. You know, unfortunately, we don't have an unlimited source of permanent supportive housing or things that huge population needs, but I would say definitely there's always, you know, we house people every week with coordinated entry.
Any other success stories from other COCs?
I'll share real quick. We recently had a permanent supportive housing project open up in Loveland. And they took all of their referrals through coordinated entry. And by the end of their kind of lease ups, when they were done leasing up at the end of the process, they had diminished the list of people eligible for their housing project down to about 3 or 4 people. So it was just really great to kind of see how coordinated entry and that project had such a kind of big impact on the people experiencing homelessness in Loveland.
Yeah, and we had the same kind of situation in El Paso County where we had the commons open, and that reduced a huge number of families on our by names list after that was open, and we matched I forget how many units, do you remember, Angela? How many units we had, but that made a huge impact on the families.
Thank you. There's another question, a clarifying question regarding, I believe, chronic homelessness. And this is from Namuna. I think that's Becky or B2. In Bill for Zero, we are only reporting single adults who are chronically homeless as per the request from Bill for Zero reporting team. Want to know from the HUD slide, are we considering families with one member with disability, youth with disability, along with single adults as chronic homelessness, or as chronically homeless?
Yeah, and this is one where Built for Zero might have slightly different methodologies, friends. Like if per HUD's definitions, if any household member matches the chronic homelessness definition that HUD provides, the household is considered a chronic homeless household. So I think that Built for Zero does have some different like subpopulations around chronicity. I'm a little bit rusty on some of the more subpopulation Built for Zero details, but I'm wondering if this is just kind of a HUD versus Built for Zero reporting question disconnect.
Next question, if we know there isn't housing available for a particular population, what is the benefit, if any, of getting that person in crisis into HMIS?
Yeah, I guess I'd wonder, because if there isn't housing right now, I mean, that doesn't mean there won't be housing in the future. If we don't know about them in our case conferencing sessions, they don't have their information to discuss. It's kind of like we can't try to help without that information, right? So.
Yeah, I would agree with that. And HMIS also offers just different opportunities for reporting, gets funders information. And so we can bring in funding using data in HMIS. So it can be really important to get somebody into the HMIS system.
Yeah, I was just going to reiterate that too, Sean, that basically it's a data thing too, that, you know, if we can show agencies or the surrounding area, like, hey, we have this population that's not being served, but they've been in here. It's all about data and funding sources and stuff. It's a really good way to keep track of the data out there in real time.
That is the last question I'm seeing. Does anybody else have questions? I think there might be a raise hand function in the chat. I'm not sure how this is working, but also you can type them into the question and answer box.
There was a good question about like different grassroots outreach groups on how they can get involved with coordinated entry if they're not already. So I just kind of put in the chat, I answered this there, but please have those folks reach out to the relevant coordinated entry and HMIS teams for that COC. Would love to have additional conversations and see what makes sense. Like there are different ways to participate in coordinated entry. Some of which that don't require HMIS participation. That's obviously the ideal situation, getting more and more providers at the table, helping enter this information and helping with care coordination in data-driven ways. But if you only have the ability to capture assessments or capture intake paperwork, just reach out to us. We'd love to talk to you more about those things.
Great. Anything else from panelists on anything that's come up with questions or thoughts or final shares?
We have talked about that we would be sending out a survey to people to get feedback on how this training was. So we're hoping to get that done. So just keep an eye out for that possibly, and any feedback would be wonderful.
All right. And with that, I will put our contact information up again. But I want to thank everybody for taking the time to attend this webinar today. Again, if you have contact or questions of specific or COC contacts, you can utilize the contact information here. We will be sending out the slides as Matt had mentioned. And if you have any further questions or anything comes up, please don't hesitate to reach out. And with that, we'll end the recording.